Hello, everyone. Welcome to the Generations Brown Bag Lunch webinar. We're about a year into these, and we've had some just remarkable presentations. And I'm Rick Tabor. I'm the host of today's webinar. And we have a special guest today, somebody who's been a frequent flyer here with Generations that we just love having. Dr. Poki'i Balaz is going to present today, and she's just got a wealth of information to share with us. We are recording this today, as I just mentioned, and these will be archived. So they actually basically will be in our Generations magazine website, which is at generations808.com. And Doug is on board here with us. We'll have that uploaded through his assistance probably sometime tomorrow on our website. All of our webinars are there. And so as I was saying earlier to Dr. Balaz, you can anybody can go and view these at any point, anytime, really simply just by going to our website. Also on our website are our radio shows, which you could also find Dr. Poki'i Balaz on a couple of those if you like. And also our articles, which I believe I saw an article recently from you. So all of that's in there. I have a mental health column that's also in the magazine. So when you go to generations808.com, if you haven't been there before, you know, it's laid out pretty well. You have the magazine that you can click on for any of the articles in the last 10 years. The webinars are next listed, and then also the radio shows. The radio show, by the way, airs on Sundays from 8 o'clock to 9 o'clock on 101.1. That's Hawaii's Oldies. It's also available. You can stream it. You can also you can actually go on Spectrum on channel 883 and listen to it as well. And those are podcasts, just like this is basically a podcast because you can watch these anytime, anywhere. And once we post them, they're actually public domain. If you can share them with anybody that you feel could benefit from the information. Also on our website, what is really cool is you can just go into the search engine and you can put something in like fall risk, and any article on fall risk will come up that we've done. Any article, any video that we've done, any show that we've done. So just a wealth of information. Also, we have some great partners. FBI is actually one of our sponsors here for the webinar. And they're probably going to, they presented recently, and they're going to probably present again here in October as well. And one of the partners is Lunalilo Home, which is where Dr. Balaz is as well. And so we have all of that. Next month, August 18th will be the next webinar. A company called MDX is going to talk about Medicare stuff. That's on August 18th. These are always from 11:30 to 1 o'clock, always a lunchtime. The following one will be September 22nd, and that's SHIP, and they're going to talk about some Medicare stuff as well. And then MDX again, and then on November 17th, we have Hawaii Meals on Wheels, and it just goes from there. Pretty exciting. Starting next month, Cynthia Arnold is going to take over the webinars. I'm actually going to ride off into the sunset and kind of pretend like I'm retired a little bit and just do my nonprofits for a while. So this, I'm going to finish. I started with the radio show with Dr. Balaz. I'm going to finish with my webinar with Dr. Balaz. And I think that's all I need to share with you for right now, because I want to give her plenty of time here. So Poki'i, if you want to just take it from there. Oh, one last thing. Ask your questions in the chat box or the questions and answers, and we will ask them as we go along. I'll just read them to Dr. Balaz as we go along, so we can make sure we get your stuff, all of the information you need answered. Okay, all right, take it away.
Thanks, Rick. Thank you to you and Generations for giving me the opportunity to come hang out with all of you again. It's always fun. Everybody, I think Rick will be monitoring anything in the chat. If I pull it up on my screen, it will be for everyone. And sometimes people send private messages. I won't be pulling it up like I just was. But thank you everybody for coming and joining today. And for those of you who will be watching it later, I'm one of those. I watch a lot of webinars later and send in, you know, responses or questions after. But anyways, so as Rick said, I'm the Director of Nursing, Clinical Services, and Home Operations at Lunalilo Home. I'm also out at KKV or Kukuakalihi Valley in the Memory Clinic. And so today Rick asked me to kind of, I think a few of you have seen my webinars, Igalani Sane, So now they've taken Savvy, where some of this information comes from, as well as other trainings that I've gotten. And so some of the information will be similar. Some of the information may be a little new, but it's always good with dementia to just kind of say it again. Um, and so thank you. So today, Rick asked me to kind of change it up a little and incorporate my journey. So that's what I tried to do. We'll see if it worked out. The timeline isn't precise exactly, but pretty ballpark. So today we're just going to talk about this journey. I'm inviting you guys to come along, and as I share my journey along with you into dementia and caregiving, and I'm sure many of you will have similar experiences, and that's kind of why I chose this slide, because a lot of times this is how I feel. This is what it feels like to think about and to dive into dementia. It's a vast unknown world that we're still learning about. We're still trying to create medications and still trying to find the cure. And so as I think Rick mentioned, besides where I work, I'm also the chair now of the leadership board of the Alzheimer's Association Aloha chapter. And so, of course, their vision and mission will be very close to heart, especially the vision to see a world without Alzheimer's and all dementias. So let's get started on this journey. Oops, Rick. Rick is not, hold on everybody, I'm sorry. Hey, Rick.
Okay. What's missing?
There we go. That's okay. Yep. Okay. So everybody, this is where my journey begins with my father. That is exactly how I got into this. So the picture on the right is how I remember my father. Growing up, he was always the Hawaiian culture was very near and dear to his heart, as well as working out in the yard. So my father spent a lot of time growing kalo, as you can see, a lot of other native plants. It's how we spent a lot of our times. And on the weekends, we spent weekends in North Shore and Waimanalo diving for fish. It's how we supported ourselves in our own mala, bringing home our own food for the week from the ocean. And my brother would go hunting. And so, of course, that's how we supplied ourselves with meat. So very humble beginnings, but learned a lot from my father, from work ethics to culturally, and really underpinnings from he and my mother, and creating my morals and values that I really live by. The picture on the right is not the most current picture of my father. If any of you have been on my social media, you'll see more current pictures. That picture, I think now, is about a year and a half ago. One of his favorite shirts and one of the few times we take him outside. So just a quick backstory before we get into it. I am born and raised here. I left for the mainland, spent quite a few years up there. My mother called me and asked me to come home so that I could assist in caring for my father. What an honor and a privilege that was to get the call. And so I came home and embarked on this unknown journey of what it is to become a caregiver. I don't regret it, but it did not come without its challenges and heartache too, as I left the place where I was building my career to restart all over in Hawaii. But again, I would do it all over again for him. So just a little bit about my father and my family. So my journey really begins when I graduated with my BSN. That's my dad at the time. We already started seeing the signs. And it was very difficult, as like many of you can see, to get a diagnosis of it, especially back then. There wasn't all this buzz and all this talk about it. People weren't as interested in it. Funding wasn't coming in as much for Alzheimer's and dementia. And so it was really hard for me to leave after I graduated with my BSN, because I knew that things were going to change. But my parents encouraged me to go. It was my time to go, and I left. I went to Oklahoma first. We'll talk about Oklahoma a little later, but I'm not that tech savvy, so the pictures were already put together, but that I graduated with my MSN in nursing education when I was in Oklahoma. By that time, his diagnosis had been made, and I knew that my time with him, is right out. Sometimes I get a little emotional when I do this, so excuse me, everybody. There's a lot changing right now in life with my father right now, so it gets time. Okay, so what I was trying to figure out what to do, I'm away. I was a caregiver, a far away caregiver, like we'll talk about after. And, I had heard all of these things, like, and people made comments like the things you see on the screen, things that I've heard a lot of my patients, families, my own staff, um, other people that had taken Savvy class asked me, like, and there's all these preconceptions. Why is he doing that? Something isn't right. I just told you that. You hear a lot of people say that, right? I just told her, I just told him. Why isn't he listening? Being stubborn, refusing to. They're doing it on purpose. They know what they're doing. Mom is just being lazy. You know how to do it. And so, right, I'm immersed in this world where I'm hearing all these things and I'm like, oh my gosh, what is dementia? What is going on? So, like we tell most caregivers, the first thing to do was figure out what is dementia. And so that's kind of where my journey began. And there's some caregivers who love to jump in and they want to research everything and find everything and go on the internet and read all the books, and that's awesome. And then there's other caregivers who kind of just want to live in the here and now and take it one day, no right or wrong, whichever is best for you. But learning about dementia, and guys, this is quick overview. So, um, you know, learning about it. So what is it? It's not a single disease. Dementia itself is that overall term. It's talking about abnormal brain changes. It's a decline in cognitive thinking ability. And that's one thing with dementia that's really hard is we can't see it on the outside. So we see how the person appears to us. And for a lot of things that we can see happening on the outside, it's really hard to relate to when you can't see physical changes as much as you can for some other things. And so that's really hard. It's progressive. There is no cure. I know everybody is probably wondering about the new medication that came out, but still there is no cure. There are treatments, pharmacological, non-pharmacological, and it definitely impairs activities of daily living. So this is kind of how we kind of describe dementia, that umbrella term. It's the umbrella term. What kind of dementia do you have? Parkinson's, Alzheimer's, vascular dementia. It's just like if you're talking about flowers in general, right? Flowers and what kind of flowers? The same question we asked when my dad was getting his diagnosis. Great, he's got dementia. What does that mean? And what type does he have? So what do we do for it? Well, first of all, when you go in, there are things, please know, that can mimic it. There'd be thyroid deficiencies, depression, medication, but also know that somebody with depression can mimic the symptoms of dementia, but people with dementia oftentimes are depressed. And so it's really good to take them to see somebody, to take them to behavioral health, or if you're thinking that that might be happening, to please, go and talk to the provider, whether it's the PCP, the geriatrician, MD, APRN, whoever is your general provider, please go and see them and be an advocate. This is like my favorite part to say, and if you're in person, and Sinai know this, we would say this over and over. So I still hear this today. Mom is getting old, it's normal. Dad, he's 90, like what do you expect? No, this is not a normal part of aging. It is not normal, not normal, not normal. If you are thinking that somebody has dementia, please, or even if it's yourself, because even for me, I'm sometimes, wonder, please go and talk to your provider, because with dementia, we know that the earlier you get on board, the better your outcomes, the more that we can help, even with that new drug that is coming out. One thing I love to talk about is the myths, right? So again, it's not normal. It is attributed that only older people get it. Not true, right? We do have younger onset Alzheimer's. People in their 30s are getting it and passing. And so it very much is not just an older person disease. Saying that, it also doesn't just affect older people, which is another thing that I hear, like, oh, well, I'm in my 20s, so it's not going to bother me. No, it does. We have 29,000 people in Hawaii living with this disease, and we know that number is low and is underrepresented. We have 56,000 caregivers in Hawaii alone. That is not a small amount of number, and that number is expected to rise just in Hawaii in the next few years to hit 35,000, and across the nation that number is huge. So just know that this number is growing. And so when you're going to the store, when you're going to the bank, when you're going over to your friend's house to visit their grandparents, this is going to become normal to be seeing people out in the community, not just in nursing home and care homes, not just stuck at home with their families, but we are going to be seeing these people, especially that have mild cognitive impairment and early stages, out in the community. So understanding how to talk with them, how to be with them is going to be essential. It's not contagious. Hereditary is only one part of it. There are things like, can you get it from aluminum, aspartame, treatments and cures? Just know that if you're hearing things, please look it up from a credible resource. Um, the diagnosis does not mean life is over. It feels like that. For those of you who have ever gone through that, it feels like the weight of the world just came crashing down into your shoulders and you can't breathe. But I can only imagine what it feels like for the person who has it. And, I think back to my father when he got the diagnosis and he tried everything to slow it down. But again, this disease, um, there is no cure. It is progressive. So know that the disease will continue, it will move on. And then we talk about behaviors, so-called behaviors, and we talk about this a lot at work when behaviors come up. And people say dementia behaviors, and it's one of my favorite things. And so I'll share this one again. It's my favorite example that a lot of people say, oh, they're not compliant. Oh, they don't want me to give them a bath. And so we really got to step back and look at it through their eyes. Imagine if you had two people coming that you cannot recognize, that you don't understand why, and they start taking off your clothes. Your natural reaction would be to punch, fight, to hold your clothes up, to cover yourself for modesty. And so you have to understand they're not being compliant, they're not being hard, they're not being difficult. They are doing exactly what anybody would do when you have strangers coming at you. So really it's looking at what can we do to make them feel comfortable, what can we do to have them feel safe, which is always a big key word, so that we can do the best that we can do to take care of them and improve their quality of life. So simple things like your tone of voice, the smile, the touching them, explaining to them what you're going to do, covering them, pulling out one hand at a time to wash them. If they're going in the shower, you should still leave them covered. I mean, none of us would want strangers walking in while we're standing there unclothed. So a lot of times it's just taking a step back. It's not what's best for us, it's what's best for them. Okay, so see, these are some of the symptoms that we talk about with dementia, right? The short-term memory loss, communication, things like complex tasks like paying bills, that starts to fade. Appointments, they start to forget. A lot of times as the disease progresses, they live in the here and now. So we say things like, oh, we got an appointment on Friday. They may get ready right after you say that. But there are great memory aids also that you can buy. And some people just, get the huge calendars and write the appointments so that they can see it every day. And that really helps, especially in the earlier stages, for them to still be organized and still have a sense of independence. They begin to have problems with problem solving, confusion. I'll show you a slide on that later that makes me feel very confused. And that is a big part of dementia because that confusion grows and grows as a disease progresses. There's also things like depression, anxiety, inappropriate behavior, which is why a lot of caregivers don't want to take their loved ones into public. But I think, society as a whole, right, we also need to start embracing and understanding, when things are happening out in public. There's other things like paranoia, agitation, hallucination. I always share a lot of stories. Paranoia. My father closed all the windows. It's Hawaii, right? We don't have aircon. It's summertime. All the windows and doors had to be closed at night because to him, that's how he was protecting us. But he also thought that people were looking into our house. I'm telling you, we didn't have anything in there for, anybody to take, unfortunately. But in his mind, people were always looking in the house and he didn't want anyone to look inside. So we had fans going, or, you just had to sweat it out, but all the doors and the windows had to be closed. Nothing we could do to change it, to fight with him about it, to open a window would just turn into an explosion. All we could do was sit back, acknowledge, understand his feelings, where it was coming from, and go along with it. Again, nobody in this world has ever won an argument with a person with dementia, and I doubt it'll happen anytime recently, or soon, I should say. Okay, so everybody asks, what are the warning signs? I forgot where I put my keys. Does that mean I have dementia? I can't find my car when I'm parked. Well, if that's the case, then I have dementia already. But no, the difference is that if you can't find your car, if you can't find your keys, you and I, all of us on here can retrace our steps, right? You can pretty much figure it out. Like, Okay, I was in my room, and then I went to the kitchen, and I got to my car, and you can go back. Like yesterday, I lost my phone at work, and I had to retrace my steps, and I found it in the nursing office with my medical assistant. So I was very excited that I didn't have to go buy a new phone. But for somebody with dementia, they would not be able to do that. They could not retrace their steps and figure out, maybe still in the beginning, but not as the disease progresses. And people ask about, I can't find my car. Well, I take a picture all the time of the floor that I parked on so I can figure out where I parked my car. So it's not as simple as that. But again, if you are feeling like you have any of these things that are on the screen, please go and see your provider. If a person you're taking care of, your loved one, your parent, a sibling, a grandparent, or somebody that you know is fitting any of these 10 warning signs, and please encourage them to go talk to somebody, but understand that it's all in their own time. It's very scary to have this conversation about yourself. It's scary to have it as a daughter. It was scary for my mother as a spouse, because as much as you want to know, you also don't want to hear that this is the diagnosis that you or your loved one is receiving, because it is a vast world of unknown that's coming at you, and a lot of it that you cannot control. And so it's a lot of planning and a lot of figuring out what to do. Saying that, we always want to say that, go in. And the reason why we encourage is because the earlier you get the diagnosis, the earlier your care team can come on, the more choices there are, the more things that means done, the better quality of life that we can expect. So what do? We look at the history, we do a physical exam, we run labs, we look at scans, we look for anything reversible or anything that could be mimicking dementia first. Because if it's something else, then we can probably address that. Your team really is your primary care provider, whether that's an MD, DO, or APRN. By this point, especially if they're older, I would definitely bring a geriatrician on board. Geriatricians, see things through a different lens, very adept with this. A lot of general providers are more than capable also of taking care of this. And usually a neurologist comes on board, especially early on. Your care team, it doesn't just mean your healthcare team. Your care team is your church, your community, your friends, your family, the people that are on this webinar, people that you're going to meet in support groups, people that are joining online webinars that you can send a message to. The care team is wide and expansive, so please don't limit yourself. There's state resources too for you to take on. So a lot of the plan is understanding what is dementia. Like I shared earlier, this is where my journey began. Yes, I had training already, but it didn't prepare me to be a caregiver, and it's not super in depth. So I had to dive in and really learn more about the brain. I had to learn about dementia, Alzheimer's specifically. What does that mean? What's coming? And then one of the hardest things to do is the acceptance. For caregivers, a lot of times it's hard to do anything else when you don't accept that the disease, and accepting that this disease is now in control. The person is not in control, and most of your reactions are to the disease, not to the person. And that's a very hard concept when you see your husband talking to you, or not acting the right way, and you want to correct them and you want to tell them, don't you remember? Didn't we just talk about this? I just told you that, hoping in some ways that you're going to trigger something for them to come back. And unfortunately, that's not how dementia works, although they may have moments of clarity. But once really accepting that this is progressive, it's irreversible, there is no cure, but that this isn't the end and there's still life, is when we can really start working together as a team and really get through this journey. And know that your care team is there till the end. Don't drop off or leave. Your care team is there to help you through the entire time. Education is always good, going to things like Savvy, Tipo Snow, um, also like Rosa and Carter Institute uh, for caregiving classes and learning and educational resources. Doing all those kind of things are phenomenal and are great to do. If you don't feel like doing those things and you want to do it day by day, that's totally fine too. Safety is always going to be the biggest concern. From whatever lens I look through, as a provider, as a daughter, as a caregiver, as the director, I am always going to look at what is safety first. And that's what drives everything. It's the only time I think that arguments are, I wouldn't say acceptable, but are more prone and okay. is when you need to make sure that the person is safe, right? And that's a lot of talks that we have in the beginning. A lot of them are staying at home by themselves. They're still cooking. But is that safe? We have to watch. My father didn't really do anything with the stove. He left the water on in the sink all the time. And so we always had to watch because he would plug the sink too. And so if we didn't get in the kitchen or listen for when that water was running, our kitchen floor would just be flooded. And then it was, time to go swimming in the kitchen. So we always had to like listen out for my father when he watched it. He would wash the dishes and then he would just get up. Something would catch his attention because, it's like squirrel. And then he would leave and the water would keep running. And before you know it, it's climbing all out of the sink. So that was, ours. Not all stories are going to be the same. A lot of similarities, but differences. Know your resources, state level, your community resources, right? We have the EAD Elderly Affairs Division that has a lot of resources, and know that caregiving isn't just about in-home care. There are resources for transportation, to deliver food to you, to clean your house. When you're caregiving, cleaning your house and trying to prep food is difficult, and time sweeps by so fast. So please pull out other resources, not just the in-home care that you can get. And that will really help you prevent burnout. Okay, treatments, like we were talking about already, we got meds, we got non-meds, cultural things. I have said it before, I use Western medicine and Lao and my father. That was my choice. This is not an encouragement for anybody to do that. You must check with your provider. Please check with your provider to make sure there's no interactions and nothing is happening. That was a decision that my family and I made for us to do it. So, and make sure when you're looking at alternative remedies or, these home treatments, that you really do your research and make sure that, it's safe, again, safe for them, and that not adverse reactions. There's also a lot of clinical trials happening right here in the islands. And, one of the priorities that just went through on the federal side for the Alzheimer's Association was the ENACT Act to went before our Congress. And that's really looking at diversifying clinical trials with Alzheimer's, because unfortunately right now there's not a lot of diversity. And so when we don't have that diversity, we don't know if the drugs are going to react the same way across the spectrum. So it's not only looking at increasing diversity in the trials, but also looking at increasing diversity in the principal investigators and the people who run the trials, which is an amazing thing that hasn't happened. And know where your support is. Please join a support group. That is where you're going to learn the most from the people who are going through it from you. And please find your care team. All right. People always want to know, what can I do to try and slow this down and prevent it? Well, here you go. This is on the Alzheimer's Association. I'm not going to go through it all one by one, but learning something new, something that you don't usually do is always a great way. Exercising, eating healthy. Basically, what's good for your heart is good for your brain. And so there are things like the Mediterranean diet. There are things like the MIND diet, MIND, which there was a study done out of the university. And so if you follow it, it's a little bit modified the Mediterranean, a little bit easier to follow. And supposedly if you follow it correctly, you could reduce your risk of like 60%. And if you do it part-time, less, 25 to 30. So, and we did do a lot of things. My father started coloring and doing connect the dot and playing board games and card games. And he was doing word puzzles and he was exercising. My father has always been active his entire life. He spent in the ocean. He was part of Poki'i, which is the Hawaiian fighting arts. He was a black belt. So he did all the things that he could to try and slow it down. Tried to eat right in the end. I won't lie to you. Big Macs, cheeseburgers, and Pepsi. He loved those things growing up. Wasn't a beer drinker, but could definitely drink a 12-pack of Pepsi. So of course, what we do before affects us later. And we know that by the time Alzheimer's symptoms are showing, the disease has been happening for 10 to 20 years. So if I have the disease or will exhibit signs of it later, I would already have it. It's already happening. I just don't know it yet. And so that's why it's so important when we're in 20s and 30s to take care of ourselves instead of party all the time. But it's life. we go through. So you can find this again in the Alzheimer's solution. Just type in 10 ways to love your brain. And you can start doing some of these things, especially if you're worried that you may have a chance of getting, dementia. It runs in my family. My grandfather had it. My father had it. So I'm definitely at an increased risk. So I try my best to do these things. I don't really sleep as much. Um, but that is something that I'm going to work on. All right, so here we go. This is a real snap, real quick, the early stages. This is a lot of times where people start going to the doctors because they start noticing changes in their memory or thinking. But they're really good at covering things up when you talk to them. That's why in the early stages, right, you're like, I think something's wrong. And then your sibling who doesn't live with you is like, nah, I talked to dad, everything's cool. You're like, no, not really. They also may start acting out and you're noticing like, wow, the hell, what was that? Oh my gosh. They have a hard time communicating, sleeping. Others may notice, again, a lot of times others don't. And then they have explanations for things like, Dad, why didn't you pay the bill? Oh, I just forgot this month. I was really busy. I forgot. Don't worry, don't worry, don't worry. I'll take care of it next month. I'll take care of it. And they never take care of it. And the bills rack up, right? Or what happened to all your money? Like, what? What do you mean what happened to my money? And then you find out that they've been involved in scams and people have taken their money. So everybody just be aware. So what can you do? On the right side is kind of some of the things we can do. So please encourage a person to see a provider. You or the person may be afraid. With my father, my mom took him to see the provider. It took quite a while to get the diagnosis. A lot of hesitancy on that end. It was unfortunate because I think, early on, maybe things could have panned out a little better. But memory aids, and we did. We used calendars for my dad. We had, the boards. We used to leave it on the kitchen table and write him, like if we were gone, what time we were coming back, where were we? We would pick up notes on the mirror in the bathroom because we always knew he was going to go to the mirror, and would tape up notes so that he knew where we were, what was going on. Because my father had to be with my mother, and if he didn't see my mother, that was it. He was going to look for her. He wouldn't stop till he found her. Even if she was in the bathroom, he would go and he would knock. He'd be like, Juana, what are you doing there? I'm like, Dad, she's in the bathroom. He just look at me and go back, Juana. I'm like, oh my gosh, my mom can't even use the bathroom in peace. So there are a lot of things going on, financial, legal issues. Please do those up front, because once the person loses the capacity to make decisions and you haven't done your legal papers, power of attorney, advance directives, it's going to be very, very difficult. So again, you're on my journey and timeline. So all of that was going through my head when I was leaving after my BSN and I'd gone to Oklahoma and I was working at Comanche County Memorial Hospital. I was going to OU, I was living in Lawton. And so my dad at this point is already going into the middle stages. And so I am trying to figure out what all of this means, going over everything I just shared with you guys, now figuring out, understanding that will be coming home eventually. What does that mean to become a caregiver? I have no idea. Nothing that I, in my education behind me, prepared me to be a caregiver. And it's very different, the different types of roles we can be. So that's in the early stages. Now we're hitting the middle. And this is where you can see they're having a more difficult time remembering things. The repetitive questions are coming. And I'm sorry, I think I said it earlier, I take it back. This is when the repetitive questions come, that's when most people start coming to say, I think something's wrong. They get anxious, there's changes in personality, they get angry, and they get suspicious. My father definitely got suspicious all the time. He thought you were talking about him or you were trying to take things from him. He thought all the money belonged to him. So if he heard it jingling, he would go to get it because he thought that you took his money. And so I had to carry around pennies in my pocket because it didn't matter what it was, silver or bronze, and hand him the money. And he would put it in socks and tie it up, and he would hide it all around the house because he didn't want anyone to take his money. And so, instead of argue with him, because he's not going to let up until he gets it, we had to adapt. And so a lot of us just had extra coins on us to hand my father whenever he felt that one of us took his money, or he could hear the sound in the pocket or in the purse, and that made him happy, made him content. No arguing, and he would move on to the next thing. So little things like that. They do get embarrassed. A lot of people do know that something is wrong and something is happening, and so they begin to withdraw. And my father did too. He knew something was happening. He didn't want everybody to know. He didn't want to embarrass my mother. That was his biggest thing. And so he started to pull back. And friends, no matter how good their intentions are, friends start to drift away, not only for the person, but for us caregivers too. I mean, my circle is really small. They don't understand what it's like. They don't understand why my father needs help 24/7 because they still see pictures or see him. They don't understand that I can't just take my father who's bedbound now in the late stages, which is coming up, why I can't put him in a stroller and spend, the whole day with them at the beach or go cruising or hanging out, why I have to go to parties late or leave early, that there's no changing tables. I can't just pick him up and put him in the car and strap him in. And so life for caregivers become isolating, and so did mine. My whole world revolves around his schedule, when he needs to get changed, range of motion, when he needs to get turned. And so there's not a lot of time to be able to leave the house. So on that note, again, you'll see on the right-hand side, really talking about going to providers. We started doing a lot of these things, monitoring meals, because dad would forget that he ate. He thought he ate. He wasn't paying the bills anymore. My mom had to take over paying all the bills, and then it came down to me. He did a lot of the shopping, the laundry, all of that stopped. Roles changed. We had to figure out what to do and who was going to take over. There's a lot of stress and a lot of issues. So by this time, I had moved over to LA. Here's another part of my journey. Knowing that my mom was going to need me and I needed to get closer, I transferred over to Cedars-Sinai Medical Center and began my journey there. I thought, though, that I had more time and I was going to be there a lot longer. And so I was on management track there with every intention of completing my medical degree and becoming a surgeon. It's what I always wanted to do. I loved it. And not realizing that this was going to change my road forever and that was not going to be viable anymore once I returned home, and hence set myself into my journey of geriatrics and brain health and neurology and caregiving. So this is my father in the middle stages. I flew everybody. I came home and I flew my entire family over to Big Island. That's where my brother was living, and this was taken at Sears. I knew it was one of the last times the family would be together and that my father would be able to get on a plane. He also has heart conditions. And it was already difficult at this time to redirect him, to get him to follow directions. And so I had us take family pictures. And so this is my mom and my father as he was sweeping through the middle stages. Now this is where I'm at. And so communication is very limited. My father doesn't speak at all. Safety, still needs safety, but he can't move in the bed, so he's not going anywhere. But he needs a lot of safety for swallowing, especially when he's eating. He aspirates a lot now, so they can't live alone. He needs help to do everything: your activities of daily living, cooking, using the bathroom, right? Bathing, all of that stuff. And he is in the end stages. So a lot of times things to look at is their pain and discomfort. It's like I have my father on Tylenol around the clock. He gets morphine as needed when I think that he is needing a little bit more. He can't tell me when he's in pain. So that's why he gets Tylenol 3 times a day to give him some coverage. He needs help with everything still, even though he can't talk. Another mantra you'll hear is all behavior has meaning. So even the small facial expressions he gives me, the one eyebrow raise, he's also had stroke, so he can't really move one side. But the little times he taps his fingers, that still is communicating with me. Or when he opens his mouth like a baby does to let you know he's hungry, that's the cues that I gotta listen to. So please know from this that all behavior has meaning. People with dementia don't just act out or do something out of nowhere. They're trying to communicate with you. So very much think about when your child or your niece or nephew was like 2 and they couldn't really talk and they were trying to communicate with you, and you would stop and listen and be a detective and try to figure it out. Well, welcome to caregiving. That's what it's all about, is trying to figure out what they're telling you with the little cues that they're giving us. We become the advocate in their voice. A lot of times their voice gets lost, and then we have to find our help, how to deal with stress, and sometimes bringing hospice on board. So this is my father currently now. These pictures were taken within the last month. So in the middle picture, you can see he's bedbound. He gets range of motion twice a day because he's doing this now, as you can see. And this happens a lot in the end stages, and it's called contractors. The wrist bends, then fingers go in, and so the nails sometimes will dig in, and their muscles start to come in. Range of motion is really important. Please bring PT and OT on, because you don't want it to get stuck like this. It's very painful and difficult to move, as their natural reaction is to push against you. And so if you bring on PT and OT and you can do the exercises or have a team to do it, it will really make life easier for them and you, quality of care and decreased pain. So you're not trying to pull their arms apart. And that's why you can't see on his bottom hand, but he has what we call a carrot in his hand to hold his hand open. His other hand is over his dog, which is one of his favorite animals. You know, at one time he thought they were real dogs, and that's to keep his hand open. This was, I think, prior to me doing range of motion with him. So after range of motion, his hands usually come down and relax on the side. And then I usually put pillows underneath his wrists so that they don't bend in. The left side, he's in a lift because that's the only way, that's the most best way to get him out. Yes, my boyfriend can like pick him up, but you know, gotta preserve his back too. So we try to take him out in the lift. And then on the right hand side is me giving him his meds. And so you can see things change. And you can see like there's Senna in the picture, which is okay. It's my dad, so I can share these. And you know, they begin to have issues with swallowing. So his meds are crushed and put into Ensure pudding because he doesn't eat as much anymore. It's a lot of energy for him to eat. So I do have him on Ensure to give him the calories and things that he need. That's how he gets his meds. Can't take pills. And then like Senna to help him move his bowels because constipation is very painful and uncomfortable. So a lot of things come on board, especially when we're going into the end. By this time too, this picture should have been before it. I had already graduated with my doctorate in nursing practice and became a nurse practitioner, which then further threw me into my journey of going into geriatrics and this entire unknown world, especially to most of us who are young. It's don't understand how hard it is to get services for those who are older, and it's difficult. And I never knew that until I had to do it for my parents. And so now we'll talk a little bit about caregiving. Let me check the time. I know I'm kind of going a little fast, but I know there'll be questions at the end. And so here's a quote from the Rosalind Carter Institute. It feels so weird to do these webinars when you can't like interact and talk with people sometimes, but anyways. So again, here's just a quote. This is a picture of just a few months ago of me coming home. My dad got really sick with pneumonia, and so he was up in the night, and so this is about 1 o'clock in the morning. I'm giving him something to eat, trying to get him to get something to eat. And so there are only 4 types of caregivers in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And so that's something that always resonates with me. So what does it mean to be a caregiver? Oh my gosh. Sanai, I wish I could turn on your mic. I would, if you explain this. So what we talk about is that the word caregiver becomes so normal to everybody, like, oh yeah, she's a caregiver, he's a caregiver. People don't really understand what that means. Like your roles change as the disease progresses. Sometimes roles drop off, sometimes you get new ones, sometimes they never drop off. So you become so many things. You become the nurse, you become the lawyer, you become the chauffeur, the one who does the laundry. You become like the legal expert. A lot of these things that caregivers are expected to do are things that most people go to school for and receive training for, yet caregivers are expected to receive a diagnosis and like, okay, go, be all these things. And yeah, you just got to do it. No choice. And so there's, for caregivers out there, I definitely applaud you and pat you on the back because it's difficult to be everything in the world for one person, especially when it's jobs that you have not been trained on. So for those of you who aren't caregivers, understand that caregivers are not just caregivers. Like, what does that mean? Caregiver is so much more. They have to be the cook. They have to be the companion. They have to be the exercise aid. They got to be PT, OT, all of this within 24 hours a day, every day, while trying to keep the person safe, while trying to implement self-care, while trying to improve quality of care for the person. So it gets very tedious. Burnout is real. And, It's stressful, but at the same time, there's a lot of rewards and benefits, and it's always great when you see them smile. So there's always two sides to the coin, but it definitely is hard. Most caregivers are unpaid and save the system lots of money by being unpaid caregivers who are giving up their jobs to do this, who are having to take on more than one job. I know caregivers in their 50s and 60s who cannot get a job now and don't know how they're going to sustain themselves because the gap on their resume is too long. And it's very unfortunate that, people are facing things like that. I left work for a while. I had to be a full-time caregiver, and returning to work was very difficult to restart your career and kind of get things going again. So caregivers are deciding all the time, unless they've had like a lot of money, between paying bills and buying food, paying the rent, medical bills. And let me tell you that those bills rack up as they go towards the end stages. Just caregiving, just having an in-home person come, it's like 5 to 6 thousand a month. I mean, his like diapers and things before hospice came back on board. I mean, I'm spending a few hundred a month just trying to get all the necessities that he needs. I mean, it's expensive. This isn't a cheap disease. So then we kind of look at what is the overall purpose and goal of caregiving. And here's some of it, right? We manage the well-being of the person. We look at their self care. We guide their behavior. We remain calm and in control. We manage the resources and we keep them involved and happy. And these are things that I had to learn. I had no idea what my purpose and goals when I first became a caregiver. I don't know, get him through the disease, make sure he take his meds, make sure he doesn't wander out of the yard and that I got to call HPD to find it, which, would be really scary. Like, I don't know what I didn't even know what that meant. I took over everything from my parents, from their medical to their financial to scheduling everything to showing up to all of the meetings to it was so overwhelming at one point to have to dive in into. And that's just the other side. Then I had to clean the house or do the laundry, make the food, make sure that he was safe because my dad made Hawaiian weapons. So like one day I heard the song going on downstairs and I was freaking out and I had to run down there realizing I had to remove that and take it away. It made him very angry. Of course, he forgot about it in like a week. So that was, the upside to it. But it's very difficult to take things away that makes them happy when you have to. And I realized that safety was one of the biggest things, and that was managing his well being and, having to pull him back from things that he loved and enjoyed. Um, it's hard to try and fit this all together. But in the end, it was to make him happy. So if he smiled, I was all good. If he didn't smile, I needed to kind of figure some things out. Remaining calm and in control is difficult for all of us when you have somebody who is so, but just know that they feed off of you. So if you're calm and in control, they will get to that point. If you are anxious and irritated and mad and the tone in your voice, they will feed off of that and it will propel them more in that direction. Caregivers, we all try our best. We have the best days, we have some days that aren't so bad, but the good thing is that we can start over again. Or, like for my dad who would forget things in like 15 minutes, then I had to restart right away in like 15, 20 minutes. So, you have to laugh and make jokes about this too. You don't have to, but it's encouraged. This disease is very sad and challenging and tiring, but there is still so much life left in this disease all the way until the end. And you got to enjoy the moments and take it for what it is. Hey, so we talked a little bit about acceptance, so I'm not going to go through all of this, but really understanding, educating. It is not you. That's what caregivers have to remember. It is not us. Blame the dementia. The person is no longer in control. The disease is, and all of our reactions are to the disease. Also understand that they are not trying to give you a hard time. They are having a hard time. So please don't argue and join them in their reality. And an example I use is if you look at the wall is white, and I tell you it's purple, how are you going to convince me that's white? And how will I convince you that it's purple? So when they're telling you things, it's true. They're telling you something that's not true, but it's true to them. And that's the purview that we have to see things through. And so they're telling you something is happening, they see something, they feel something, please acknowledge it. It'll de-escalate things because whatever they're feeling, whatever they're seeing, it is in their reality. So it is true as our reality is true to us. never argue with them. And I hear it a lot, like, my dad is doing that on purpose. Well, he's really not. He didn't ask you 20 questions because he just wanted to annoy you. He asked you 20 questions because he really doesn't know. He doesn't feel safe. He's feeling vulnerable. He's uncertain. And another way to look at it is whoever they're going to is like their safety blanket. And so, they see you as that. Okay, caregivers deal with all of this, right? Like you're a therapist. Personality traits disorder, depression, effects of the disease, attention, aging, and substance abuse, which can happen before or after, and all of the behaviors. Um, Most people put resource slides at the end, but I put it here because this was part of my journey. We're not at the end yet. And part of my journey was figuring out where the resources are. So, of course, one of the first places I reached out to was the Alzheimer's Association, because hello, why would I not? And so, definitely dove in there and started taking the classes, going on their website, looking at, everything that they had, understanding, reaching out to that team. Ivy, who is with the Shaka, right up front, was one of the first that I contacted. She even helped me with resources to write my, my project and my doctoral program. And so, then I took Savvy Caregiver, became part of the national task group. So things like Rosa and Carter, Kathy White at High Holy, wonderful. Rick and I have been on so many things together. Center on Aging with like Dr. Nishita and all of our state agency. It's really a community out there. We're there. Sometimes it feels like you're alone and hard to find, but there's so many places to look at and to go around. So this was part of figuring out how to be a caregiver. Was where are the resources? Where's my help? And that's exactly what I did along this journey. Right. And this is confusion. Does this just hurt your eyes? It hurts my eyes. So what I try to depict in this is what it feels like. So I guess I should step back. To be a caregiver, I had to understand in some ways what the person was going through, right? I have to have some way to relate, some way of understanding. And so if you can imagine like confusion being the size of like a dime in the beginning, and then it grows bigger and bigger and bigger. So somebody in the early stages, right, they have a little bit of confusion, like, what did you just say? I thought you meant this. But by the time they're in the late stages, I mean, they are living in a world of confusion 24/7. And that was really important for me to understand because, get short with the person when they don't understand things, they don't pick it up as fast enough as they did. You get really annoyed. And so understanding why it's happening really helped me to be able to step back, and my mother, and kind of wusa and be able to deal with it a little better. Okay, so again, all behavior is meaning. What this slide is showing is that something always happens before the behavior. Behaviors are not just, oh, they have dementia, they have these crazy behaviors. No, there's always something that happens first. And so a lot of times I tell my families if they can keep a journal for me so that I can go through it and look to see who was around, what happened before, what were they doing. Sometimes it's simple things like at night when people don't close their curtains and they think that somebody is looking in the house at them because they can't recognize their face anymore at the age that they are at. So they get really aggressive, they get mad, they think somebody's looking at them. So if you just close the curtain and take it away. And my father, at one time he was in the bathroom and I said, "Hey dad, who is that? Like, is that John?" And he said, "That's not John." And when I showed him a picture of him when he was younger, he goes, "That's John." And so, he already didn't recognize. It also kind of tells you kind of where they are in life. So,
Hey, Poki'i, we have a question. Would you mind if I asked it?
sure.
So mahalo for sharing, and for me too, all your personal experiences and your photos. Those are remarkable photos, man. Your beautiful Ohana. Wondering if you might talk about the influence of Hawaiian medicine in caring for someone with dementia. Do you have a second to talk about that?
Sure. So I'm definitely, I wouldn't say an expert in law. I'm a student right now. So if you are very interested in it and want to dive deep into actually using it, then at the end of the slides we'll have my email address, and definitely send me an email and I will refer you to someone. Again, I do have to put that out there that this is not, an encouragement for it to be used. These are all personal choices, and you should let your provider know if you're bringing anything else on board. um, I decided to use it because my father and his mother practiced it. And I very much loved learning more about my culture, and my father started teaching me before the disease took over. And in the Hawaiian culture, there's, you know, a lot of medicines, natural medicines. I grow some of it on my own, make it on my own. I don't have a huge yard, so I can't grow it all. And so there are modifications, but I decided to use it. And I'm sorry if I'm not answering your question, please type in again for Rick. I decided to use it because my father used it himself. I was also interested in seeing if there would be any remarkable effects to me. I kept a journal with what I did, what I gave, and what happened after. Now, maybe it's biased too, because I'm looking for something, right? And so maybe I'm seeing something that wasn't there. But a lot of medicine, just like our Western medicine, Hawaiian medicine, there are certain plants and things that are aimed at the neural system, that are aimed at the brain, that are used for hypertension and things like that. So I gravitated towards the medicine that would help the neurological system and were specifically targeted at the brain and especially this disease. Um, did it help? I mean, my father has lived longer than anybody ever thought. He's passed away, not passed away, he has had about quite a few close calls. One just last Christmas when we were tending to him, everyone really thought that he was, you know, going to go. And so I don't know. I think it's going to be a combination of things, and I can't put it all in the medicine. I think, you know, he definitely gets cared for at home. He gets one-to-one care. That's probably part of it. Um, but it's a combination of things: environment, the food, the meds. So I kind of hope that answers your question. If it didn't, please type back in or email me after, and I could, you know, we can always talk story some more. But that was a good question. I usually get asked that.
Thank
Um,
you for answering that.
No problem. So we're talking about behaviors. You want to really kind of figure out what the problem is that you're dealing with. They don't want to bathe, right? So keep a journal of it. Who, what, when, where, why is this happening? Make some kind of plan, any plan. Doesn't matter what you decide to do. You want to change the environment. For bathing, sometimes it's understanding that they don't have to bathe every day. But when they do need to bathe, how can you get them in there? Why don't they want to bathe is always the key question, right? And bathing is a huge problem. I don't have the answer. Everybody is different and you have to try different things. Some people, it's worked by it's just because it's cold in there. So they put a small heater or they warm it up. They let the shower run. Um, a lot of times people with dementia are scared of water. And so like if there's a puddle on the ground, they will go around it. I'm not sure if it's just they're not sure what it is or what they're seeing. So that could be part of it. At one point, my mother would get in the shower with my father and bathe him. Then came a point where he, you know, didn't want anybody to see anywhere. So we would have to stand outside and close the curtain and kind of prompt him on what to do. Um, you know, other people have played music, they've turned it into a game. Shower benches are good, they can sit down, taking the soap, putting it in a pantyhose so that it doesn't slip out of their hands and they always have to reach down is good. And then they can grab onto it, hold it, and wash themselves. You got to take it out after though and make sure everything dries. But um, and saying that you always want to make sure that they do what they can do. Caregivers, we want to take over. It's faster if I do it, just let me do it. But the more that we do, the less that they do. So we want to encourage them to keep doing what they can because that helps them to stay as independent as possible. So think outside of the box, set a goal, try it, implement it, troubleshoot it. So I'll share one quick story. Like my dad got really fixated on toothpaste too. I have no idea why. So he wanted toothpaste all the time. So I just bought, you know, like the 99-cent toothpaste. Like I would just buy a bunch of them. And during the day, he would want his toothpaste. I would just hand it to him and he would hide it everywhere, like the ice box, the freezer, the shelves behind books. I don't know. So, you know, my mom, they pretty kind of got irritated, but I just turned it into a game. Like I would number them or put a dot or something on them. And my dad would go and hide them everywhere. And then at night when he went to sleep, I would go find them. And if I like, I would be like, hey, I gave him 15 today. Let's see if I can find 15. Never ever found all of them, even after we moved out of the house and took everything out. I don't know if some are in the yard, but you know, it was either that or would argue with him or tell him he already got one. Tell him, no, I gave you one already. He doesn't remember that. That would have just turned into an argument and him getting very frustrated and irritated and aggressive. So it made him happy. we did this for like an hour a day. He was content and involved, which we'll talk about soon. And, I knew that for an hour, all I had to do was hand him toothpaste and I could do something else. So, figuring out little things to do with that. Always, again, look at their emotional truth, validate it. And then, it's our responsibility to carry things out. So I kind of inserted here aggression and agitation because this is a huge one that people talk about, right? And so when we're trying to address this with somebody who's getting really agitated or aggressive, these are the things that you can do. You want to keep it very simple when you're talking to them. You want to change your tone, make sure it's softer, your face looks pleasant. You want to back up, give them their space, calm yourself down. You want to, if they are still able to, do breathing with them, maybe rub their hands, try to calm them down, and always come to their eye level. So a lot of times I'll squat down to talk to people who have dementia because if you above them, not a good feeling. But if you come to their eye level or underneath and look up at them, very much more responsive. And then identifying triggers, which is why we ask for the journal. A lot of times it's the time of the day. It's an alarm that goes off every day. It's somebody that comes to visit. It's something that really frustrates them. Please be aware of the TV. As it progresses, they think things on the TV are real. So my dad is a vet, loved war movies, can't show him war movies anymore, or Law and Order SVU, because he would try to go help the person in the screen. So, we have to kind of take a look at the environment and the surroundings and make sure that it's conducive to them.
One more question.
Sure.
So Randall's asking, what are your thoughts about utilizing supplements for brain health, and what supplements have you seen that have truly been beneficial to enhance brain health?
Yeah, I get this question a lot. People always ask, well, like ginkgo and, even multivitamins, fish oil. So nobody ever likes my answer. So I'm not going to endorse anything or say anything, especially as a provider. What I can say is that you are the advocate, you are the person, and do the research. If you were thinking of bringing something on board, I don't know, fish oil, ginkgo, anything like that, do your research to understand the why. Again, let your provider know, your geriatrician know that you're going to be doing this. Have that discussion with them. You are in the end going to decide what you want to do. And then if you do employ it, then keep a journal and write down if you see that there are any improvements or not, right? It's just like when we talk about Namenda and Aricept and we put it on, are we seeing an effect with it? And if we're not, then a lot of times, well, not all the time, sometimes families or the provider will suggest to pull it off because there are no beneficial effects that we're seeing anymore. For others, those things work great and they want to keep it on. So it really, really, really is going to be just a decision. And from what I see in clinic, though, and stuff is, you know, it varies and it depends.
Right. So really know the individual that you're trying to help. Thank you.
When we talk about memory, so what's on the slide right now is for the caregiver to know that when we're thinking about memory, that they're going to forget social skills. Oh, I know. So sorry, you guys are going to get tired of all my stories. So my father, social skills were gone. He was very blunt. Like some of my residents, like they notice when I haven't slept or brushed my hair, and they're very blunt and they let me know, which is fine. But my father also has, so a lot forgot his social skills. So a lot of times they like children, and so when we would be out like at Foodland, my dad would be like, "Come here, little girl, little boy," and I'd be like, "Oh my gosh!" Right? The parent is like, "Who's this crazy guy trying to grab my kid?" But it wasn't. He just like thought it. I don't know. Maybe thought it was his grandchild and wanted to hang out. I'm not sure. But so their social skills are forgotten, right? They don't understand that you got to stand in line. They don't understand that you got to pay for things at Walmart sometimes, and we'll walk out of the store. There was a case like that in the mainland, and so you can't rely on their memory to prompt them. Please, orienting them is not important. It doesn't matter if they don't know it's Tuesday or that it's July. What is today? I don't even know. Does or 21st, I think, and so
21st.
thanks, Rick. So like it's not important. And I know a lot of people want to reorient them because they feel like no, but they'll notice it'll help them. It sometimes makes them reminds them in a way that they have something wrong with them. It can bring on their irritation, their aggression, even grief for them that they can't remember things. And then sometimes they're like, why can't I remember? And they get very down. So it's not important anymore. What's important is just that, the day is going well. We're managing things for them. They're happy. Don't expect new learning. A lot of my family still is, oh, he knew how to do it yesterday. There are good and bad days, but we shouldn't be expecting that they're going to learn new things at this point. And things may feel familiar, but everything is new. So sometimes they see the same person, the same caregiver over and over. It's not necessary that they remember them. They just know that there's something familiar there. And so it's a sense of familiarity. So my mom, will say that a lot, like, dad remembers you, because we're always like, I can get him to smile sometimes. Sorry, dad doesn't remember me. And how I know this is because when I came back to visit from Oklahoma, my father said, who are you? And I said, dad, it's me. It's your baby girl. It's Poki'i. And he looked at me and he laughed and he goes, I don't have kids. And he turned around and walked away. And I was like, all right, then. Now I'm orphans. Okay. And so, I didn't say anything to him. I didn't try to convince him. I just accepted that. And so when I would see him, I would shake his hand and I'd be like, hi, John, my name is Poki'i. And I would just introduce myself to him over and over every single time, like 51st dates. Okay. So then we talk about reasoning is another thing for caregivers. You can't reason with them. There is no bargaining, negotiating. Sometimes actually in the beginning it works. The hospice girls used to negotiate with my dad or bargain with him. They would give him candy, um, so that he would let them do what they needed to do. Okay. Sometimes it works, but for the most part, you can't have a reasoning like, if you do this, I will give you this. If you complete this, then you can go and do this. They live in the here and now. They want what they want. They're going to do what they want to do. There's no reasoning behind it. It's happening. And so they don't think in cause and effect at all. Like, don't leave the stove on. You're going to burn down the house. They're just going to turn on the stove because they know they want to cook. But they don't realize they got to turn it back off. And a lot of times things like this with driving comes up, right? They still want to drive. What do we do? Okay, so you'll see on the slide, it says, don't confront them, like come at them, like, we're taking away your keys. Don't drive. Too bad. Sorry. No, no. We don't want to overreact anyway. You really want to think of it from their side, because what are you telling them? That they're not independent anymore. They can't do things on their own. That's a really big thing for people who are older to swallow, that they have to use a cane, that they can't get out of the car anymore the way they used to, that they need help reaching for things, cooking, cleaning. I mean, everything is telling them that their independence is going, and driving is a huge thing. Driving means you can't leave. You are stuck wherever you are, and you have to depend on other people to take you. Okay, so definitely meet with the team, talk. There's been things that you can see on the right-hand side. Um, they're taking them to the DMV so that they can have them retested. They fail the test and then they re-show them, things like that. I've had people do that. I've had people use the lock bars. They can't drive, although it makes them very, very mad. I've had family members detach the battery so that they try to turn on the car and then the car doesn't work, right? Because you have to think out of the box. You can't just be like, Dad, you cannot drive. Oh, I told you that. Like, they're going to get irritated and angry, right? Like, why? Give me my keys. Give me my keys. Sometimes, other times they're more they don't get as mad. So you have to try different things. Although I did have one family tell me that they did the battery thing, and then her husband called the company to come over and fix the car. So she had to tell them what was going on. So they didn't accept any more calls, or things like letting air out of the tire.
We had the grandkids take the car. So the grandkids just had the car. And then they
Right.
would return and they would run errands with them so they could still be in their car,
Mhm.
So they would just come take them shopping, things like that, kind of make it natural. And the story was that they really needed a car anyway, the grandkids. And so that made grandpa pretty happy that the car was being used and that they would run errands with them and he could spend time with them. So it's kind of a natural way that we approached it in our family.
I like that way. It's good because one of the techniques too is to like see who can drive them around and to figure out ways like not that you're helping them but they're helping you, like, I want you to come to the store with me today to do whatever it is you need to do. And so yeah, there's many different ways. And so see, like, joining a group like that, you can learn from so many people what they're doing and how to help them. So like judgments, you know, you're going to assume responsibility for their safety. Don't try to overprotect them. It's a natural thing. We want them to be able to do things. Um, I know that it's not personal. Your perception, you have to know how much is enough. A lot of times they have hallucinations, delusions. Again, remember, if they're seeing something, it's true to them. A lot of people have difficulty. They say they don't want to lie to them. Well, you're not really lying because in their reality, it's happening. So you're joining them. So a lot of times, if there is somebody else in the room or they say, oh, he or she has seen something, I just ask the person, like, you know, do you feel safe? Does that make you mad or angry? If they say no, then, you know, just kind of keep monitoring. That's not the only way to handle it. And I usually will address if they say, like, I don't know, Tom is here with me. I'm like, hey, Tom, how are you? How are you doing today? You know, so it's not that I'm saying that it's real, but it is real for them. And for me to tell them anything otherwise would be to now get into a battle about who's right and wrong. Their safety, of course, is number one. And so all these kind of things to help with safety. Clearing clutter in the house is big because that it sometimes makes them feel overstimulated when there's so many things around them. Also stops them or helps to stop them from tripping. Um, Using things like lights at night to show them where the bathroom is. We know a lot of people who like go use the bathroom in the closet or in the corner. Well, if you have a light and kind of the strips, they even have lights that you can put on the toilet seat so that like you can turn off the light, but the toilet seat is lit up so they can see it. Um, they start missing the toilet seat, and especially if the wall is the same color as the toilet seat, they can't. Their vision starts to change. They can't see where one ends and one starts. So know that using contrasting colors on your carpet, your floors, if you're trying to get them to see the toilet, that is going to work really well. So things like flat paint, right? Areas that you know there's going to be a lot of spilling, like linoleum for your floors, swivel seats to help them turn more. So, you know, they don't have to like try to turn themselves a little bit harder. Covering up your power cords, covering doorknobs if they wander and they're trying to get out, or using things like they have wallpaper that looks like a bookshelf or other scenes, um, so that they don't go for the door and try to leave. Other things you can do is put a dark sheet in the front. They will assume that it's a hole and and so they won't cross over to go to the door. Phone bumpers, looking at mirrors. Sometimes they get mad when they see themselves in the mirror. So sometimes you might have to cover the mirrors too so that they're not arguing with the mirror or get into a fight with the mirror, which has happened. And then for your own safety as a caregiver, back brace, um, you know, the belts to help you lift, those kind of things are important. Chairs with arms are important to help them get up themselves. And don't put low chairs, you know, chairs that are higher so they don't have to do the rocking motion to get out of the chair or out of the car. And so there's a lot of things that we can do to improve safety. Attention and organization, this of course decreases too. And that's kind of when we start talking about your purpose, order, use. Well, use and order is supposed to be separated. Sorry. So just know that for them, it starts to decline. The purpose of something starts to go. They start not understanding what the purpose was, which then affects their ability to use it. Um, and especially if it's something that has a certain order to it, like brushing their teeth. Sometimes they, you know, don't put the toothpaste on the toothbrush, they put the toothpaste on their finger on the back. And so what you'll see on this picture is fidget toys, and these are things that get used before the end stages. And so that's an apron, and that's something to keep them busy with the buttons. My father likes dogs, so I got him the dog fidget toy, and you'll see the beads. It's for sensory stimulation, and the ball, then he can play with the ribbons, and there's zippers on the other side. And so that helps to keep them engaged. And on the right hand side, that was in 2017, I think, he was still able to draw, play with cars, do some things with blocks. And so that's what we had him do. Eventually, I put the crayon in his finger and he just stared at it. He had no idea what to do. I would move his hand. Sometimes he would do a couple, and eventually he would just drop the crayon. And that's when I knew those times were over. We had moved on from that. He doesn't play with with the fidget toys anymore. He'll hold on to the dog, but he doesn't do anything more with it. Those times have also ended. And so can see the progression. Um, but I do give my father a lot of credit for being as brave as he could when he heard the diagnosis, and doing whatever he could to try to slow it down. This is contented involvement. So this was also back in 2017, 18. My father would still dance. And so you see the phone on there. So contented involvement means something that they're content and involved in. And if you as a caregiver know that they're going to be content and involved listening to music for an hour, that means you know that you can go do something for self-care an hour, not clean the house or do chores, but something that is going to make you happy. And so my father liked certain music, so we would put it on. He's deaf. He's really hard of hearing, um, not deaf, but hard of hearing. And so we had to put up there for him to hear. And so he would just crack up and laugh, and he would dance, go side to side, or he'd make his head or his feet would go. I still dance with my dad now, but he doesn't dance back with me anymore. But it was just an example of contented involvement. And so contented involvement, don't think about with anything. Like if they like to garden, if they can't go out to the garden, bring the garden to them on the table, bring some hot soil. We're not looking for them to do things correctly, just that they're engaged with something. Um, Doing the laundry, a lot of times give them the laundry. They fold it all up, put it in the basket, round the corner, mess it all up, give it back to them. I have other ones who do the table over and over. They set the table. They're just looking for purpose also. Anything to have them be content and involved. And then you as a caregiver have time to take care of yourself. And that's how you kind of match it. This takes them 15 minutes. I got 15 minutes. What can I do? A small nap. This takes them half an hour. I got half an hour. What can I do? As long as they're safe. For me, I got a pool. I put it in my lanai because I can't go to the beach on the weekends anymore. And I fill up that pool, and that's my beach from now on. So that's my self-care when my dad is content in his Airbud movies currently right now, or watching the Golden Girls. Hey, abstraction for a lot of people, like we were saying, you want to be concrete. So things like, we are going to your brother's for dinner on Thursday. Too abstract. We want to say thing. You want to wait until Thursday and say, we're going to John's house for dinner, and then they'll get ready. If you know they take 3 hours to get ready, please tell them 3 hours in advance. Um, when I learned everything that I just went through with all you guys, I learned that there was a lot going on with dementia stigma. And, a lot of times realizing that the way they get treated and the way they are treated is because of the stigma that we all have, that we all do. Um, and that's why this, so another thing that is how to burst through that stigma and make this more acceptable and normal. And so that was definitely, these are things that came out of that journey, belonging to these organizations, going back to school, because thinking about business and what I want to do and where do I want to be, working at KKV in the memory clinic, going to Chaminade and teaching about geriatrics to make this more normal, working at Luna Lila Home and becoming part of this awesome team that I get to work with every day, that hearts are in to just improve the quality of life for Kupuna. You can see our garden back there as we farm to table. We have an adult day center. We have residential care home. We have activities. We have Native Hawaiian culture infused throughout. We do private meal deliveries into the community. We also take our residents out on excursions. Um, we're gearing up for La Hoi Hoi Ea, and we're gonna have, all the Native Hawaiian games and Lauhala and entertainment coming. And so there's just a lot that we do there. Rick is, I think, in some of these pictures with me. My biggest thing came out of this was doing advocacy and policy work to really drive policy to make changes that's going to affect not only my family, but families across the state and at the federal level, which is why, just like Rick, with Alzheimer's Association, I'm a state champion to our representatives, ambassador to Senator Schatz, but I'm also the policy chair as well as the chair of our leadership board. And so that is where spending a lot of time meeting with them, going to DC, meeting them here locally, and driving change, which is really what we do. Self-care is huge. I make my mother go get a manicure and a pedicure once a month. This is her. She fell asleep. I know we're waiting on time, and so I'm going to wrap it up right now. Please, everybody, self-care is important and must be done. I only have like a couple more slides, Rick.
You're fine. Keep going.
Okay, well, now I'm gonna wrap up soon. And I just want to acknowledge that even though on the right-hand side you see the woohoo and there's all these rewards, that there is a grief continuum with this, and that for caregivers, grief continues for the entire 10 to 20 years, shorter or longer. And that as you lose the person along the way, the grief starts again and it changes. And every loss that happens, they can't walk, they can't talk, the repetitive questions, the spouses who can't share memories with them anymore, daughters like me who can't have a conversation with their father anymore. All of those are losses along the way that all instill the grief again. So while I talk a lot about the positives, it's not without acknowledging that there are the moments that become the darkest. See, like I'm getting choked up. But it's in those times for me to remember like that he could still smile, and that when I come home, I'll still be able to get that. And so there's ups and downs definitely throughout this journey. So starting today, everybody just please make a self-commitment to yourself that you're going to self-care, right? Start by taking a pledge. I do this if we were actually in person, but we're not right now. And focus on what they can still do, not what they can't. And here's my care team at home that helps me out.
Oh, you're locking up. So incredible presentation. I'm sorry, Dr. Balaz, you're locking up, Poki'i. So I want to say remarkable, just everything that you do, everything I've done with you has just been very special. And I want to say a special congratulations. We kind of started before we started with this. Doug O'Brien actually congratulated you on your Pacific Business News under 40 class of 20, 40, was it 40 under 40 class of 2021 award. That is so well deserved. So everything that you do. Are you unlocked now? No, I think we lost Dr. Balaz. There, are you back? You were freezing up. Yep, I think we've lost you.
Am I back?
You're back, kind of choppy. Do you have anything in closing? Can we make it work? So, folks, like we said, there you go. Pretty choppy. So we're going to upload this recording will be on the generations808.com. Should be available sometime tomorrow. And I'm just going to wrap us up because you are locking up, but we've got everything else. It's worked very smoothly. If you have any questions, go ahead and just email them to us. I think if you take a look here, you'll see that Dr. Balaz has left her email. I've left my email address on there, and we'll go from there. Are you unlocked? Anything? Okay. All right. So thank you for joining us. And thank you, Dr. Balaz, for all the wonderful information and heartfelt too. Thank you for keeping it real, as someone says in here. I really appreciate everything that you do and you. Okay. Thank you, everybody. I'm going to stop the recording.